we're starting on time, we're here and we're alive.
Once again, welcome, welcome, welcome.
I named this talk, You Can't Keep a Good Man Down, and that's around my mental health history and the challenges that I've faced across my lifetime. When I was significantly unwell, this is how I described my, my mental health at the time. And I described it as a snakes and ladders board. What I knew at that point was that I'd been squashed to the point by betrayal and the mental illness itself that I didn't know how to climb ladders anymore. So I had to focus on snakes. And what I mean by that is that, and many people I've talked to also speak about this snake knowledge, and it's what's the agency in how you cope? Yeah. How do you grab hold of the agency around how people cope? And it may be through drug and alcohol abuse. And so I went to visit a GP. On the first conversation, he was quite brief and quite straight with me, and you know, this is what I think you need to do. And in the second conversation, he left about 8 people waiting in the waiting room and spent an hour with me to work through what I needed to say and how could I move forward. And he actually unpacked that and took that hour, and I was so amazed to come out into the waiting room and see people waiting. And it was like, this one person is willing to spend time with me and hold back others in order to have my story and my recovery be of importance. It was a massive achievement. And that was a turning point for me. He talked to me about my snake knowledge. He wanted to know about how I'd survived, how I'd made it this far, what I'd done, without laying judgment on any of those things. And it was powerful. What do you think about that? What do you think about a doctor who might spend that hour? Has anyone got examples of how that works?
The reality is that for each person that comes in, they're not just a mental health issue, they're medical issues. There are a whole lot of issues that we've got to deal with. And you know, that G in general practice is not G for God, because we're actually supposed to look at all the bits and pieces that come through, have a handle on it all, and process it. So it just means clear thinking, having a line of thinking as to each one of the things that you deal with, where they all interact with each other, and remember that I am not necessarily the best person to be the holistic manager of one condition, but to recognise for each of the conditions that you deal with that you are part of a team. So,
just very quick answer, like one word answer almost. Is it fundamentally more time efficient to give a decent lump with a troubled patient so you can be briefer later?
Absolutely.
So the definition of recovery from the medical perspective is the absence of symptoms or the significant reduction of symptoms. Rehabilitation is about improving lost function, but you can reduce symptoms and you can increase lost function and still live a meaningless, purposeless life. Or you can be engaged in a full, meaningful life with reduced functionality and while experiencing symptoms. But if you're engaged in a life that has meaning and value to you, then chances are your well-being, your levels of well-being are going to be high. And you can experience mental well-being in the presence of mental illness. You can have mental illness but high levels of well-being. It's the people that have mental illness and low levels of well-being that are in the danger zone.
Using TMS. If you do a high frequency stimulation, it excites and makes them more active. And if you do a low frequency, it inhibits. So there have been a lot of studies where they either try and excite the left to sort of bring its activity levels up, or they try and sort of inhibit and suppress the right side. And overall what they've seen in studies is that the HPA axis normalizes. And for instance, in patients, they've been able to demonstrate patients with a serotonin deficiency where they labelled it and did the scans before and after and showed that the serotonin levels returned to normal.
The issue with cigarettes If cigarette smokers commence smoking as teenagers and do not quit, then eventually half of them will die of tobacco-related diseases. That's astronomical.
I'm a volunteer. I am a Lifeline telephone crisis supporter. One highlight is just seeing so many people in one room that are focused on mental health. Also seeing the focus on support networks, and that recovery process isn't just about that one person, it's about the family and the friends and everyone getting on board to support the individual.
So I'm a nurse and I work for the Ministry of Health with the Whole of Hospital program. It's very good to see so many people from different specialties coming together to try and improve things for consumers through so many different avenues.
I work for Partners in Recovery program. I've sort of gained quite a lot of valuable input, but it's also been nice to speak to people outside the sessions as well. So I think as much as it's been good to get the information within the sessions, it's been quite nice to have the networking in between sessions. You maybe hear someone mention something and go to them after and talk about that. So far, all in all, it's been very good. I think for me, probably, I'm most looking forward to the ones that are coming after lunch and around the mindfulness stuff.
Personally, I think mindfulness skills can be pretty much useful whatever you're doing. And even if you're not actually using it with people that you're working with, if you've got a sense of mindfulness about yourself, that's going to be useful. And the idea of mindfulness, when it's used in our work, can be that we can actually have a different conversation. We can actually slow things down, we can connect, we can maybe talk about the things that matter. What I don't want is that when people come to talk to me, that it's a bit like sitting down with a girlfriend for a chat over a cup of tea. I don't want that, because they don't have to pay someone for that. They can go and get that elsewhere.
Well, the first thing I'd like to say is just how proud, as chairman of the Medicare Local, I am of the way that the Medicare Local has grasped mental health and run with it, and the programs that we've rolled out for this community has just been fantastic. And one of the things about the Partners in Recovery program and why it is such a good program is, firstly, it identified a need, it identified a real gap where we could deal with anxiety and depression, but we've got these patients, they're almost the heart-sink patients that we've known, that we have in our practice, that you just don't know what to do with, because their needs are so vast and so much. But Partners in Recovery has brought it all together, and now we've got an access so we can go to that point, and then it rolls off into all the other facilities and all the other services that can get involved and help those people to really make life bearable again. And the third thing today, well, I just had a great day. I think it's been such a good day. I think I've learnt a lot. It's made me more insightful and made me feel that I think when we leave today, we'll all be better professionals for attending today. So thank you very much.
Thanks a lot. Thank you.
And you know of the many things that we're trying to do to support our community around programs and services, but I just wanted to go over the main programs and services that we provide to support our community around mental health. And I just wanted to acknowledge all the wonderful services and our local partners that have come along today and presented their information either in our sessions or had a stall outside. That was fantastic, and just to provide the opportunity to network and find out how everyone's working, how we can work better together to service our communities. And I thought I'll just leave with some information about the Way Ahead database. I know we've had lots of conversations about where do I go for help, what information's out there, I don't know where to find it, and so on and so forth. And it's something we deal with all the time, because that is, you know, there's so much change happening with programs and services and what's funded and not funded and where do you go. And one of the initiatives of Partners in Recovery across the state was to support the Way Ahead database and its re-establishment online. And this is potentially a one-stop shop for services in our region.